Hello and welcome to Northamptonshire Wellbeing Programme. My name's Sharon Ireson and I'm one of the breast care nurses from Northampton General Hospital, and I'd like to talk to you today about what's going to happen next now that your breast cancer treatment has finished. So one of the first things that we'd ask women to do after their breast cancer treatment is about breast awareness, and that is about you looking and feeling your breast and your chest wall if you've had a mastectomy, also under your armpit and around your neck, and just keeping an eye on that for any changes that might occur. This can be quite difficult to begin with because after surgery and other treatment, things can be very different to what your normal was. But we'd like you to begin to get to know what is now normal for you, and so that you would pick up and notice any changes that might happen. If you do notice any changes, and these can be seen from the slide that you're looking at now, we would like you to report those and contact either your GP or your breast care nurse if you did have any worries or concerns about this. So the other thing that we ask patients to look out for following your breast cancer treatment are other new signs and symptoms around the rest of the body. This is always a big worry for a lot of patients after their treatment, but it's really important to remember that there's lots of other normal things that can account for these signs and symptoms, and sometimes just getting these checked out by your GP or your breast care nurse, you can be reassured about them. But you can see from the slide the different things that we're asking people to look out for, and if you did notice any of these for a period of 2 to 3 weeks where they didn't improve, didn't get better, we would encourage you to get those checked out. For the majority of people, these turn out to be nothing to worry about at all. But again, we just encourage you to get them checked out if they persist for any period of time. There are lots of other things that you can do to help as well, and there's some research to suggest that having a healthy, balanced diet along with regular exercise, which can help keep and maintain a healthy weight, can contribute to the reduction in recurrence of breast cancer. Another significant thing that can help is that if you have been prescribed a hormone treatment, that you comply with this, and if you are having problems with this, then please contact us for help and support so that we can help you to maintain that. Any sort of problem or any concern in the future, we always suggest that you would either contact your GP or breast care nurses if a problem arises. So what happens next with regards to your appointments? There are some patients who will have a clinic appointment 1, 3 and 5 years after diagnosis, and you will be told about this if this applies to you, and this will also be written on your end of treatment summary that you and your GP will receive. All patients will have open access to the breast care service for 5 years after diagnosis, so that if you did notice any problems like we've been discussing and you were worried about those, you'd be welcome to call the breast care nurses and they will guide you as to what the next steps should be. Again, if it's appropriate, depending on the type of surgery that you've had, you will also be entitled to have annual mammograms for the 5 years after your diagnosis. After this time, depending on your age, you would then go back onto the national breast screening programme every 3 years. Thank you for watching. I hope this has been helpful. You'll see some contact numbers here for the breast care nurses and also our Cancer Information Centre and Macmillan Cancer Support. Thanks very much.